My name is Susie Welty. I'm with the University of California, San Francisco, the Pandemic Initiative for Equity in Action. I'm going to talk to you a little bit today about trauma-informed approaches and respecting the context. Actually, I'll pass it off to my colleague for respecting the context. But we're going to just start with an overview of understanding the definition of trauma and identifying types of trauma, describing the principles of trauma-informed approaches. Well, hopefully by the end of this, you'll be able to understand how to identify and address secondary trauma and explain implicit bias and how it might impact a contact tracing interview. Just to clarify, we're not actually teaching you how to deal with trauma. It's more just how to identify and prevent triggering traumatic instances during a contact tracing or case investigation interview. So what is a trauma-informed approach? Broadly defined as practices that promote a culture of safety, empowerment, and healing, and that encourage support and treatment of the whole person rather than treatment of individual symptoms or specific behaviors. So it really is a holistic approach and how we view sort of our role with the clients that we're going to be talking with and empowering them, promoting safety. So trauma-informed care shifts the focus from what is wrong with you to what is right with you. Its healing-centered engagement emphasizes individual strengths and resilience, recognizing the impact of trauma without minimizing it. In a program, organization, or system that is trauma-informed, realizes the widespread impact of trauma and understands potential paths for recovery, recognizes the signs and symptoms of trauma in clients, families, staff, and others involved with the system, responds by fully integrating knowledge about trauma into policies, procedures, and practices, and seeks to actively resist re-traumatization. And that's why this is part of our contact tracing and case investigation training, is we really want to approach this very delicate topic with people and make sure that we are resisting re-traumatization, that we're focusing on the client and their needs and helping to meet them where they are. So what is trauma? Individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. And it overwhelms their ability to cope. So really this overwhelming of their ability to cope is the central part of what trauma really is. So trauma is actually much more pervasive and widespread than I think we would imagine. Many people in the US have experienced trauma. Between 50 and 90% have experienced some past traumatic event, depending on your definition of traumatic event. More than 50% have experienced some form of direct interpersonal violent victimization. More than 50% have experienced the sudden death of a family member, close friend due to violence, an accident, or a disaster. 8% have been exposed to violent combat or have lived in a war zone. And between 15 and 25% have experienced child sexual abuse. So this actually, it's likely that somebody that you do reach on the phone will have a history of trauma. And as we know, in this current setting with COVID-19, traumatic events have increased reports of intimate partner violence and child abuse. So it seems it might be getting worse even. And then in addition to those things, just generally, this is a hard time emotionally for many people. There is a lot going on, a lot of social isolation, and a lot of very difficult things, including job loss and economic instability. People with history of traumas may be more severely impacted by the trauma brought on by this pandemic. As service providers, we may have our own trauma histories, and we may be emotionally impacted by the trauma of our clients. And that's really important for us to acknowledge and to deal with. Learning how to provide trauma-informed care also means learning how to protect ourselves from being traumatized by our work. So let's just talk a little bit about the types of trauma. there are several types of trauma, and that was sort of the point at the beginning. In quantifying trauma is difficult because the definitions are different, and each person, a traumatic event might be different for each person. But generally, there are some types. So there's acute trauma resulting from a single traumatic incident, such as the victim of a crime or a natural disaster. There's chronic trauma resulting from repeated or prolonged traumatic incidents, such as intimate partner violence. There's complex trauma. Cumulative trauma results from exposure to varied and multiple traumatic events. And this could be a combination of acute and chronic trauma, and it often starts in childhood. There's secondary trauma, and this is what we're going to focus on looking out for in ourselves and in our peers and the work that we're doing this. This is trauma related to stress reactions and symptoms resulting from exposure to another individual's traumatic experiences, rather than exposure from direct trauma. So this is also called vicarious trauma. And this is something that you'll really need to be mindful of for yourself and for your colleagues. Historical trauma, cumulative emotional, psychological, and social wounds shared by a community as a result of collective cultural trauma. And this is something that we're definitely seeing and experiencing in the US right now, with a lot of focus on racial systematic racism. And then we're talking about intergenerational and transgenerational trauma. This could be cumulative emotional, psychological, social wounds shared by family members, and could be over many generations. So as you can see, there are several types of trauma. And then there are also different responses to trauma. Trauma is not simply the event, but the response to it, and that it overwhelms a person's ability to cope with the experience. This may result in feelings of helplessness, inability to express the full range of emotions. And people have a wide range of responses to trauma, including emotional, and these could be inability to regulate emotions. Physical, it could actually be pains or somatic sort of expresses of trauma. And cognitive, loss of sleep or inability to focus. Behavioral, acting out or reaching for substances and increased substance abuse. Some of these are conscious attempts to cope with what has happened, while others are unconscious and not in their control. All trauma responses should be treated with compassion and care. Trauma resilience. There's some common resilient responses to trauma. They are increased bonding with family and community, redefined or increased sense of purpose, increased commitment to a personal mission, revised life goals and priorities, increased charitable giving, community organizing and or volunteerism, and increased physical and emotional care for self. So these are resiliency responses. And it is important for us to think about these in the context of our work in contact tracing and case investigation, and how we can improve our own resilience. So there are several principles of trauma-informed care, and these are based on the SAMHSA pillars of trauma-informed care. There's safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, cultural, historical, and gender issues. I'm going to talk about 3 of these in particular and just gloss over the other 2. Some of these are more in the context of continued engagement with a client. And so that's obviously not the situation that we will be dealing with. We'll be calling someone once and possibly following up, but most likely it'll be a one-time encounter. So some of the pillars are less relevant in that context. And some of them also in this current context are also a little bit not as relevant, such as empowerment, voice, and choice. we can work with someone to help them come up with the best way to quarantine or the best way to isolate, but there aren't a lot of choices in this scenario. In collaboration and mutuality, we can appeal to their sense of working together as a community, but there isn't a whole lot of ability for them to have sort of mutuality. So those are sort of principles that are important, but maybe less relevant for this specific context. But the ones that are very relevant in this context are safety. So what social, physical, and psychological risks do clients face when being contacted? How can those risks be mitigated? So what do they feel unsafe about? Their immigration status, being stigmatized, losing their jobs? What are the fears and concerns that they're going to have, and how can we mitigate those? Trustworthy and transparency in the case investigation, contact tracing context. As we know, there's a lot of distrust in government. There's a lot of challenges related to the health department reaching out to someone. And so it is important that we establish trustworthiness and transparency and ask them. And that's as simple as making sure they understand why we're asking questions and why we're doing what we're doing, and helping if they feel uncertain about whether this is a scam call or not, making sure that they feel that we're trustworthy, giving them ways to verify who we are. And the main principles here are that can the clients trust that their private information gathered will be kept secure and not shared with others, so confidentiality, and can clients trust that we will be honest with them and not lie to them, so lie about the safety of their data, about what we're asking them to do, about who we are. And then there's cultural and historical issues in the case investigation and contact tracing context. So it's important to ask ourselves at this point, have I or other staff been trained in providing affirming services to diverse communities that have struggled with cultural and historical racism and other stigmatizing things, immigration status, others? Have I been trained in that? Do I know how to be sensitive to that? Do I treat clients equitably and with respect, regardless of their gender, race, ethnicity, and other identities? And some of these questions are even hard to ask ourselves or answer for ourselves. And in the next session, Respecting Context, we'll talk a little bit more about biases, implicit and explicit biases, and what that means and how we can sort of check those biases. If a client or colleague gives me feedback on my language, am I open to hearing it? How might historical trauma impact the way clients and colleagues show up for services, or whether they do what we're asking them to do? How trauma responses might manifest in a CI or CT call. A person may be difficult to talk with, they may be despondent or low-spirited, they may be angry or hang up on you, yell at you, they may be mistrusting, sad, or afraid. These are all common responses for a lot of people, but particularly maybe people with trauma histories. Techniques for dealing with these situations. First of all, reframe your thoughts. People who have experienced trauma are not giving you a hard time. They're having a hard time. It's not personal. It's not about you. It's about what they're going through. So when they yell at you or if they hang up on you, which in my experience is actually not that common, but if they do, it's not about you, and it's not that they're trying to be difficult. This is a difficult thing for them. Take a deep breath and pause if needed. Respond with kindness, compassion, and empathy, and respect their context. And that is something that we'll talk a lot more about in the next segment, how to do that. So recognizing and addressing secondary trauma, and this is something that over the months of case investigation and contact tracing that we've been doing in San Francisco, we have recognized that this idea of secondary trauma, vicarious trauma, is very real and has impacted many of us. And it's important for us to acknowledge that early on, and also to find ways to identify it and to prevent burnout from it, really. So identifying secondary trauma. There could be uncontrollable physical or psychological reactions to client disclosures, nausea, sleeplessness, ongoing anxiety, avoidance of topics during client interactions or when recalling client interactions during supervisory meetings, limited emotional expressions with clients or colleagues, nightmares or bad dreams about work or events recalled by clients, negative thinking about clients, that person's a jerk, they're manipulative, a liar, depression and or detachment from family and friends. So these are all signs of secondary trauma. And secondary trauma leads to high levels of burnout, compassion fatigue, numbness, disconnect to the suffering of others, and high rates of staff turnover. So it's really important that we focus on taking care of ourselves. So a word about self-care. We need to take a breath and be good to ourselves. Connect with others. Peer support is one of those pillars of trauma-informed care, and that applies very much in the context of the work that you're doing. Step away, take a break from the work and the pandemic media. Take care of your body, make time to unwind, and use some resources that are online. There are a lot of great apps, mind space apps that help with meditation or other mindful activities. And so use those resources. Thank you so